Dzień za dniem, noc za nocą. Nasze życie upływa pod bezkresnym niebem. Marzymy o rzeczach wielkich, ale życzymy sobie rzeczy prostych. Myślami wybiegamy do przodu, ale jesteśmy świadomi, że życie toczy się tu i teraz. Spoglądamy w niebo z dobrego miejsca na ziemi.
Witamy Was bardzo serdecznie w Kujawsko-Pomorskiej e-Szkole. Jest godzina 9, więc czas na pierwszą lekcję. Będzie to lekcja języka angielskiego dla klasy pierwszej Liceum Ogólnokształcącego. Poprowadzi ją pan profesor Maciej Doksa. Witamy serdecznie.
Good morning, students. When I was asked to run the English lessons in this online school, I have been thinking what subjects actually we could do so that everybody would be happy and everybody would find it useful. I believe that English is a subject that has to be used to discuss, to reflect everyday occurrences, everyday events. As you all perfectly know, right now we have this terrible pandemic of coronavirus infection. Therefore, I decided that today we will talk about it, but in English, so that you will know the vocabulary and the facts concerning this terrible disease. So, the subject of today's lesson is coronavirus symptoms and treatments. Objawy i leczenia koronawirusa. So, first of all, many of you probably wonder what are the symptoms of coronavirus, how to know, how to guess whether somebody actually has this virus. So let's take a look. I have put a list of some symptoms and we will try to decide whether these symptoms can actually be the symptoms of coronavirus infection. So the first one is vomiting. What is vomiting? Well, actually vomiting is when you feel bad in your stomach, when you feel sick and the contents of your stomach go out. So wymioty in Polish. The next one, dry cough. What is dry cough? Well, coughing is basically when you're cold or when you have some kind of chest infection and you start coughing. The next one, headache. Well, I guess you all know what headache is. The next one, swollen ankle. What is a swollen ankle? Well, for example, when you twist your ankle, which is part of your leg just above your foot, after a time it usually becomes much bigger. Then we say that it is swollen. So is swollen ankle a symptom of coronavirus? We will see. A rash. Do we have a rash when we have coronavirus? Well, what's a rash? First of all, a rash is some spots which appear on your skin. Usually you get a rash when you have some kind of allergy, food allergy, or it also may be the symptom of other diseases. So rash in Polish would be wysypka. The next one, diarrhea. This is quite an unpleasant symptom. Diarrhea usually occurs when you have eaten something bad or when you have some food poisoning. Then you really need to go to toilet very quickly and you have to do it quite often. So diarrhea is biegunka. So is diarrhea a symptom of coronavirus infection? We will see. Problems with breathing? You know, problems with breathing is when you actually cannot breathe very well, breathe in, breathe out. So, because we know that coronavirus is a virus which affects your breathing system, respiratory system, well, it is quite possible that it is a symptom of coronavirus infection. Fever or high temperature, it's actually the same thing. Fever, high temperature, when your temperature is above 37.5 degrees, that's what the doctors say. Tiredness, feeling tired, is this a symptom of coronavirus infection? Well, we will see. The next one is runny nose, nasal congestion, and sneezing. Runny nose, well, this is actually when something comes out of your nose and you have to blow the nose quite often. Some liquid comes out of your nose. Nasal congestion, in simple words, means that your nose is blocked and you cannot breathe through the nose. Sneezing, well, sneezing is actually connected with runny nose and nasal congestion. From time to time, you release the air from your lungs quite quickly and violently through your nose. So, are these the symptoms of coronavirus infection? Possibly. Sore throat. Sore throat is when you feel pain in your throat. You cannot speak, you cannot swallow food. You generally feel pain in the area of your throat. Aches and pains. Well, this is actually more or less the same thing. Ache is when something hurts, some part of body hurts. Pain is more or less the same thing when part of your body or an organ hurts. Bleeding. What is bleeding? Well, bleeding is a situation when blood comes out of your body in an uncontrolled way. So is bleeding a symptom of coronavirus? Let's see. Dizziness or feeling dizzy. This is actually the same thing. This is when you feel as if your head is going around and round and round and round, and you really feel that you cannot get the right balance and the whole world seems to be moving around. This is dizziness. Zawroty głowy. Stomachache. So what about stomachache? Is stomachache a symptom of coronavirus? Well, I'm sure you all know what stomachache is, but whether it is a symptom, we will see. Pneumonia. What is pneumonia? This is actually quite a serious disease, although the name sounds quite nice. It is a disease of your lungs. It is a very, very serious infection of your lungs. In Polish, it's zapalenie płuc. You probably know that pneumonia can be caused by bacteria or by viruses. And the bacteria which cause pneumonia, in Polish, they are called pneumonia, zapalenie płuc. All right, so we have discussed some possible symptoms. Now let us see what actually are the symptoms of coronavirus infection. Well, according to the World Health Organization, the most common symptoms of coronavirus infection, COVID-19, are fever, tiredness, and dry cough. However, some patients may also have aches and pains, nasal congestion, which is blocked nose or runny nose, sore throat, or even diarrhea. These symptoms are usually mild and begin gradually, which means you don't get these symptoms, over a period of 1 hour. They don't appear quite suddenly. In fact, the time between the infection and when you start to show the symptoms is about, on average, 5 days. That's what the World Health Organization say. Another thing you need to know about this virus is that some people become infected but don't actually develop any symptoms and they don't feel unwell. In fact, it is claimed, according to various studies, according to various researchers, that between 30 and 80% of all infected persons are asymptomatic. Asymptomatic means they have no symptoms. So they are infected, but they don't actually show any symptoms and they don't actually know about it. That is why the disease is so dangerous and spreads so quickly, because actually there is a quite big group of people who don't know they are infected, so they don't stay in isolation, they don't stay in quarantine, they just walk around, go to work, meet other people without actually knowing that they are spreading the virus. That's why the spread of it is so quick nowadays. All right, the next very important question is actually how we can get infected. Well, again, according to the World Health Organization, people can catch coronavirus from others who have the virus. So it's a disease which spreads or jumps from a human to a human. The disease can spread from person to person through small droplets from the nose or mouth, which are spread when a person with coronavirus coughs or exhales. So that means that whenever you are close to somebody who has coronavirus and this person sneezes or coughs, these tiny droplets, these tiny particles from your nose or from your mouth, they can carry the disease, they spread around, other people breathe them in, and that's how they get infected. Also, these droplets can land on objects and some surfaces, so on things around you. Other people then can catch COVID-19 by touching these objects or surfaces, and then touching their eyes, nose, or mouth. So in this way, the virus can actually also get into your organism. People can also catch coronavirus if they breathe in droplets from a person with COVID-19 who coughs out or exhales droplets. That's what we have already said. And this is why it is so important, it is so crucial actually, to stay more than 1 meter, in English about 3 feet, away from a person who is sick. That's why right now you see all those restrictions, limitations, limits on the number of people who can enter one space, for example, a shop or a public space. And that's why those people actually have to keep a distance of about 1 meter from each other. That's why it is so crucial. Now, is the virus very infectious or contagious? Infectious and contagious, these two words actually mean the same thing. It means that you can catch the virus. In Polish, zaraźliwy, zakaźny. So the question, is the virus very infectious, very contagious? Of course it is. It is extremely infectious, it is extremely contagious. That means that you can catch it very easily, you can easily get infected. That's why we have to follow all the rules, all the regulations of isolation that are in force right now. So as we said before, because the virus is so infectious, so contagious, it is extremely important to stay more than 1 meter from each other. We should also avoid touching our eyes, nose, or mouth, because it is quite possible that our hands have previously touched a surface which was covered with coronavirus. Once contaminated, hands can transfer the virus to your eyes, nose, or mouth, and from there the virus can enter your body and can make you sick. Contaminated. Well, contaminated in Polish means skażony. In this particular case, contaminated with the virus, skażony wirusem. That is also why it is so important to wash your hands as often as possible, and also to disinfect your hands using a special disinfecting liquid, which in English is often called a sanitizer. Well, many of you probably wonder who can actually get infected. So, is it only children and teenagers? Is it mostly young adults? Is it middle-aged people? Is it elderly people or people with other health problems? Pregnant women, overweight people, or anybody, meaning everybody can get infected? Well, I'm sure you have been following the news and you have heard that actually anybody can get infected. That means that everybody is at risk of catching this disease. Of course, you cannot catch it if you have already been infected, you have been sick, and you have recovered from the disease, which means you have become immune to the virus, so you cannot get sick with it again. But if you have not been sick with coronavirus infection, that means you can catch it. However, studies show that some people are at a greater risk of developing a severe illness, severe symptoms. What does severe mean? Severe means that it's very hard, it's very serious. Your health is in danger, your life is in danger. So who are the people who have the greater risk of becoming very seriously ill with coronavirus? So who are the people who can develop a severe COVID-19 illness? Well, let's take a look. Well, is it overweight or obese people? Well, what does overweight or obese mean? Well, overweight and obese mean more or less the same thing. It means that somebody is just too heavy, too fat, that he weighs too much. Or maybe is it underweight people who can catch the disease more easily than others? What is underweight? Well, underweight, as you can guess, is the opposite of overweight. So people who are just too thin, too slim, people who weigh too little or less than they should according to medical standards. Or maybe it is elderly people who are at greater risk of developing serious symptoms. Babies, children, teenagers? Well, or maybe it is smokers who should be more careful about catching the disease. Or perhaps it is people who suffer from other diseases and health problems. Well, what does it mean to suffer from a disease? When you suffer from a disease, it actually means that you have this disease, that you have the symptoms of the disease, and the disease causes some problems to your health. So maybe people who suffer from other diseases and other health problems are at a bigger risk of catching this disease. Well, we will see. Or maybe it is one of the two sexes that is more likely to develop very severe symptoms, so men or women. All right, so let's actually see what are the answers to these questions. Well, the World Health Organization, WHO, says that while we are still learning about how COVID-2019 affects people, older persons and persons with pre-existing medical conditions, pre-existing meaning that they existed before, such as high blood pressure, wysokie ciśnienie krwi, heart disease, choroby serca, lung disease, choroby płuc, cancer, nowotwory, or diabetes, cukrzyca. They appear to develop serious illness more often than others. So as you can see, there are actually groups of people with a higher risk of catching this disease. So let me, not only catching the disease, sorry, but developing serious symptoms and serious illness. So let me say this once again. Who are the people who are at greater risk of severe coronavirus disease? So older or elderly persons, persons who had some pre-existing, so earlier medical conditions. And such conditions can be high blood pressure, heart disease, lung disease, cancer, or diabetes. Is it all? Are these all groups of people who can be more seriously ill with coronavirus? Well, what about children and teenagers like yourselves? You are probably quite interested in what is the risk to you. Well, in this respect, in this case, World Health Organization has some quite good news for you. So illness due to COVID-19 infection is generally mild, especially for children and young adults, which means the chances are that if you become infected with the virus, if you catch the virus, you will probably not suffer, you will not show very serious or severe symptoms of the disease or severe consequences. However, you have to remember that this is only a probability, high probability. This does not mean that all the children and all the young people will just go through the infection, you know, like nothing happened. What about smokers? Well, there is one universal truth about smoking. Smoking is bad, always. It's always bad in any situation, in any context. So smokers are actually also at a greater risk of having a more serious coronavirus symptoms and illness. Why? Well, because smokers quite often, more often than other people, suffer from lung diseases, choroby płuc, because they smoke. For example, lung cancer. They often suffer from heart problems. They often suffer, or more often suffer, from coronary diseases. What is coronary disease? Well, coronary disease is the disease of your circulatory system, of your heart and of your veins. So because smokers more often than other people, than non-smokers, suffer from lung diseases, heart problems, coronary diseases, they are definitely at a greater risk of developing COVID-19 serious illness. So remember this. Smoking kills. This is the universal truth, whether you're speaking about coronavirus or anything else. Let's go back to the list of groups of people who are at a greater risk of serious disease. What about overweight people or obese people? Do they have a greater risk of catching the disease? Catching the disease, maybe not, but developing more serious illness, well, unfortunately, yes. Why? Because these people, statistically, more than other people, suffer from diabetes, cukrzyca, heart problems, coronary disease, which unfortunately can make the coronavirus infection much worse and much more dangerous. What about the two genders, men or women? Is there any greater risk for one of the genders, one of the sexes, of developing a more serious illness? Well, in Italy, which is right now as we all know, the country which is suffering the worst consequences of the pandemic spread, they have noticed that most of the patients who develop serious illness and who actually die of the disease are men, about 70% of them. They do not know, the researchers, the doctors, they do not know actually why it is so, but statistics clearly show that. Perhaps it is due to the fact that maybe men generally, statistically, smoke more than women. There are more men smokers, and they suffer from various diseases connected with smoking, which make coronavirus infection worse. What about age? Is age an important factor? Well, actually, yes. Unfortunately, most of the patients who suffer from severe illness, coronavirus illness, and who unfortunately die of it are elderly patients. That is why it is so important that we keep a distance from elderly people, try to protect them, try to avoid infecting them. All right, so we have this disease, we have this terrible pandemic, and as with all diseases, you are probably wondering, what can we do about it if we catch it? Is there a cure? Is there a vaccine? Is there something we can do to help, to get better, to recover? Well, what is the treatment for coronavirus infection? Is it antibiotics or maybe chemotherapy? Or maybe just common aspirin will help? Or maybe we need steroid injections. Injection is when they stick needle into your skin and put some medicine through your skin, zastrzyk. Or maybe you need surgery, operation. Maybe there is a vaccine that can help us prevent catching the disease. Or maybe if you have a sore throat, you just take throat lozenges. Throat lozenges, these are the tablets that you take when you have sore throat and you just suck on them. Or maybe it's just enough to take a cough syrup. Or we should take a common cold remedy or flu remedy, which are so common nowadays and you can buy them at any pharmacy. Well, actually, we will find out the answer to these questions after the break during our second lesson. So thank you for now and we'll stay tuned.
Bardzo dziękujemy panu profesorowi. To była pierwsza lekcja angielskiego dzisiaj dla pierwszej klasy Liceum Ogólnokształcącego, natomiast kolejna już o 9:45. Zapraszamy gorąco.